Welcome to How to Accommodate a Patient's Request to Amend the Health Record. I'm Dr. Michael Warner with Patient Advocacy Initiatives. Before we get started, please answer 3 quick questions. In addition to specifying the patient's right to request access to the health record, the privacy rule also gave patients the right to amend their health record. To amend the health record means to alter or change by adding, subtracting, or substituting information. The privacy rule, also known as the Standards for Privacy of Individually Identifiable Health Information, became the final rule of HIPAA in 2002. As we discussed in the last module, compliance with the privacy rule was required as of April 14, 2003. This first compliance date was for larger practices and health systems. Small medical practices were given an additional year to comply. The Code of Federal Regulations, Title 45, which is public welfare, Part 164, Section 526, showcases the patient's rights. Patients have a right to request to amend their health record. If a person is an authorized personal representative of this patient, then this person is to be treated the same as if he or she is the patient. As mentioned in an earlier module, amending the health record is tied with complexity. If a patient finds an error or a mistake in the health record, then the patient has the right to request to fix it. If you review our government's Medical Office Survey on Patient Safety Culture, 2012 User Comparative Database Report, you will see that health record errors occur. This survey was of medical office workers and was conducted by the Agency for Healthcare Research and Quality. The 2012 database includes information from over 23,000 medical office staff respondents from over 900 participating offices. Over the time of the survey, 62% of the respondents had fully implemented EHR systems in the office, while 13% were in the process of EHR implementation. Based on surveys sent to medical office staff members, the wrong health record was used while taking care of a patient 1% of the time. This roughly equates to 1 patient per week per full-time clinical medical provider. Staff members reported that entering information into the wrong patient's chart, whether it was a test result or a scanned document, occurred 2% of the time. The survey draws attention to important patient safety issues, but likely grossly underestimates the occurrence. If information was mistakenly entered into the wrong chart, who would notice? And when would it be noticed? Many patients do not realize an error in their healthcare record until they receive a bill for a service that was never rendered to them or a prescription that should not be on their medication list. Some health records are hijacked as part of identity theft. Joseph Nen, a staff member for the Los Angeles Times, wrote a 2006 article, ID Theft Infects Medical Records. Mr. Nen described the plight of a 56-year-old school teacher who received a medical bill for a foot amputation and diabetes care. The teacher sent notarized pictures of her feet without resolution. She eventually went to the hospital to show that she had 2 feet and no diabetes in order to alert administrators of the error. A year later, she had a heart attack and became unconscious. When she awoke 2 days later in the hospital, a nurse asked her about her diabetes. With all that effort, she got her bill fixed, but not her health record. When interviewed, she was scared that she could have gotten insulin shots. Maybe she did. The Los Angeles Times article observed that most people never find out about erroneous errors. Though the school teacher's case occurred in 2006, you can see how frustrating it would be today for a patient to correct an error in the health record. Whether due to error or identity fraud, errors must be recognized and corrected. According to the privacy rule, providers have 60 days to respond to a request to amend. The privacy rule, which supports patient access, also supports patient amendment of the health record. The Office of Civil Rights, OCR, is responsible for enforcement, which includes complaint investigations and compliance reviews. And as we previously discussed, they have a toll-free number and an online complaint portal to receive complaints and initiate investigations. It is important to note that civil money penalties and criminal prosecutions are inflated if there's any evidence of health provider or staff retaliation. The rule specifically states that a covered entity may not intimidate, threaten, coerce, discriminate against, or take other retaliatory action against any individual following a complaint. If the patient complains, then the patient complains. If you can help resolve the issue, then work with the patient to resolve it. All along, you want to avoid any discussion at the workplace or documentation in the health record that could be interpreted as retaliation. If a patient spots a laterality error, such as left versus right shoulder, you should be able to amend it with ease. If the amendment has more to discuss, then you should consider recommending that the patient complete a prehistory. This will alleviate you of the need to link and notify. Plus, you can document that you gave the patient an opportunity to set the story straight in the health record. If the patient needs training, then they can watch this educational series for free. The prehistory is a replica of the history that you're supposed to do, if you asked every single question. If you sat and completed a traditional detailed history with the patient, it would be very rewarding. It may also take you more than 30 minutes. I believe it can be just as rewarding to read what your patients write in prehistory, which will take you about 30 seconds. Based on the patient's story, which now looks like a detailed case, you will be prompted to dialogue with the patient, engage your 23 years plus of schooling, and tap into your experiences as a clinician. We have a cover letter identifying the prehistory as a form of patient-generated health data and as an official request to amend the health record, along with the prehistory form available for free on our website and our Facebook page. Is this manageable for a busy office? Yes. Let's address data management in the next module. First, answer 3 quick questions.